agenda so that we can see what we're doing today. Let me just see now. Here we go. Oh. Please tell me if you can see this, because I can't see anyone now. So can everyone see that agenda for today?
Not yet, Mandy.
Okay.
But it sometimes takes a moment to load, so don't worry.
It does. I'm thinking it might be better, if possible, for someone else to share the slides for me. Kate, are you okay to do that for me? Thank you. Well, I can talk through the agenda. We don't have to have that one loaded up straight away. So basically, on our agenda today, we have got Godfrey, who has very kindly come to talk to us today about his experience applying for roles as a final year student, and then also his journey as a preceptee up until the present time. I think we've got the agenda coming up now. Yes, that's great. Thanks, Kate. And then afterwards, we have Paula, who's presenting today on behalf of Wendy, as Wendy is unfortunately not able to be with us at short notice today. So Paula will be presenting about the NMC and the roles and responsibilities of the NMC and a new registrant after Godfrey has presented. And then unfortunately, Davina can't be with us today either, but Kate is going to talk to us about student support and interview preparation and about the Learner Toolkit app, if you're happy to present those slides as well, Kate, if that's all right with you. Okay, so without further ado, because I feel like I've wasted enough time having some technical issues, I think what we'll do then is go straight to Godfrey to hear your story. Please, Godfrey, that would be lovely. And I believe, Kate, you've got Godfrey's slides to share for him. Thank you.
Yeah, hi everyone. Yeah, thank you, Mandy. Yeah, I was just thinking about the slides as well. So my name is Godfrey. I think if you can put up the slides, then I'll just quickly go through my slides as well. I've got about 20 minutes. I hope I can cover it within that time safely. Yeah, so hello, good afternoon. So my name is Godfrey Lusigi, and I'm a registered mental health nurse working with an inpatient functional older persons service at the Julian Hospital in Norwich. So today I am here with one of my students. She's called Muriel. Probably she can introduce herself.
Hello, my name is Muriel. I'm a final year mental health student.
Yeah, thank you. So I'm currently the assessor for Muriel, and she's about to finish her placement very shortly in the coming week. Yeah, so before pursuing my nursing career, my background was in human resources management and politics. Is what I trained previously. Then I had gained a bit of some experience across administration and also healthcare. But my journey really began into nursing really began in 2020 at the height of the COVID-19 pandemic. Around that time, the pandemic revealed in a personal way how significant mental health is and how wide the gap can be for those who need support. So for me, I saw friends, thriving professionally but struggling silently. And two of my sisters who live with sickle cell disease became part of also my reasons as to why I came and I joined mental health nursing. So my bond with them and the desire to be a consistent source of help and support really strengthened my conviction that mental health really was where I needed to be. So that caused me to push to enroll into mental health nursing, and the place where I got mental health nursing, my application was successful, was at the University of East Anglia. So I enrolled, that was back in 2023, and it was one of the most insightful times of my career and education, and I really enjoyed every bit of it. So towards the end, as I was approaching the end of my career, I became intentional about exploring pathways available to me and to me as a newly qualified nurse. So this led me. I think if we can go to the next slide, this led me uh, to conversations with my peers and tutors, and it broadened my understanding of the opportunities within and beyond clinical practice. So when I approached the end of my my nursing career, I really engaged my peers. I listened to my peers. I listened to what my peers were going through at the time, because they were also looking for jobs. They were also in the process of trying to find placement. And I think that was a good point of encouragement for me. But beyond that, I also attended university organized job fairs featuring local healthcare organizations. And in those organizations, there were quite a number of organizations that came in those job fairs. And that was really insightful for me, because I was getting all the information from all the different organizations. Striking for me was there was military there was charity organizations there was faith-based organizations there were different hospitals there, both within the local setting and beyond. And that was really fascinating, because I was picking all their materials and I was listening at what they have. They were offering different things, and those were positions of considerations for me, because I was taking all that information in and I went back and sat on it. Some of them it was it was about the money. Some of them it was about the enticing prospect that they had to offer. I was thinking about some of the nursing careers. I mean, I didn't know there are different areas you can actually explore nursing in, but that was through the fairs I saw some of those possibilities, availed, and that gave me a lot of options and considerations at the time. So I also gathered information and reflected on what aligned with my values and aspirations at the time. And within that, I sought one-to-one guidance from the university's careers team. So I remember my peers talked about, oh, I've already booked a session with this career counseling people, and I'm like, what? Where did you get that information? Where are they? And it's like I went and I also got my session booked in, and we explored. And it's, there are questions. Why do you think about this area? Have you thought about this? Have you thought about the other? And we just explored, and that was a good thing for me, because it really opened me up. The other thing was about networking. It played a central role in my decision making. So during placements, I built very strong professional relationships with practice education facilitators and senior clinicians. And their insights really helped me understand the different services and consider where I would thrive as a newly qualified practitioner. So I remember engaging extensively with the clinical educators, the placement, networks that I built the networks that I built during my placement time. And all those connections were at that time now very relevant, because I remember, oh, I worked in this particular area and I met somebody who worked in the children's service, and I'm contacting them and they're telling me about the opportunities that are available there. I talked about somebody who is an inpatient adult, and I was considering all those options and how the team was, and I'm finding out about how they're working in that team. That was very insightful information for me at the time. So networking really played a pivotal role for me. So when I chose, I decided. I think you can go to the next slide. I made a choice to choose the NHS. There were different options I could have gone for. I could go back into the private sector, or I could go somewhere else. But I chose particularly the NHS. And this was a deliberate choice that I consulted extensively, especially among family. It took me time to reflect with the material that I had. I consulted deeply with my family. What do you think? There's this option here and there's this other option there. I could go here or I could go there. What do you think? What do you suggest? The place also, because of the relations and the place and the connections that I'd made locally, informed my decision because I trained here in Norwich, so it felt I felt more. I didn't want to explore. I didn't want to go to an area where I felt personally, oh, I'm not ready to undertake an adventure. For some people, they will love the adventure, but for me, it wasn't the adventure at the time. It was, I think, I just wanted to consider a place that I've already established connections within the placement areas. I know how they work. I know how they function, and then that's what informed my decision. So I searched for roles, particularly through the track jobs. The track jobs is a very useful tools because it's like a minefield. You see all the jobs available in NHS across England, and I was like, wow, you're looking for band 5 role, and it's like 30 roles come up, and you're like, wow, am I going to apply for all these? At first, it was the joy of excitement, but then I started to now narrow down what am I interested in those areas. Are they the areas that I really want to work in? So I'm reading the job description. I'm reading what they have to offer, the people specifications. I'm reading their manual and what the area. I'm reading the entire package to see if it fits. Some packages had relocation packages, and I'm thinking, do I really want this? Looks attractive, but then my final decision was I wanted to stay within the NSFT, which is Norfolk, Suffolk, and the Norfolk and Suffolk Foundation Trust. So here I'd established professional connections through placement. I'd also engaged extensively with education facilitators, particularly, who were very supportive to me. So, like I said, these relationships that I engaged really helped in me navigate the application process from shaping my online application to preparing for interviews, and ultimately contributed in securing a job within NSFT. So, yeah, so within those discussions, again, I had one-to-one career discussions. I remember some of the practice education facilitators they offered, and I was like, I chose among the teams, and we had to book slots and we had career discussions. Those discussions were really helpful. So from there, it's when now it opened, it broadened my perspective, and I wanted to work with the older persons because there are different areas. I could ever choose to whether work with the male, with the female, with the adults, or with the older persons, or with the children, with the mother and baby unit, with the community teams, the crisis team. There was quite a number of offers, and those are the offers. And based on their also availability and the jobs that they had at the time, really brought it heightened my attraction in those areas. So yeah, we can just go to the next slide. So during my placement, I've said that led me to secure the job. So during my preceptorship year, when I began, I continued to grow personally and professionally, and I have seen been appointed into different roles. One was within the Reach Network, and then the other ones I got also another opportunity to enroll within the Roots to Success leadership program. So that's within the NSFT, because now I got those relationships, and those relationships just within 1 year have really grown and budded, and I'm really appreciative of this. So I just want to share a bit of some reflections. For me, it's a privilege to speak with you guys today and to prepare. And as you prepare to step into your practice, I say not long ago, I was exactly where you are, especially for the newly qualified, excited, nervous, hopeful, and wondering what the transition into nursing would feel like. However, I want to share just a few reflections that supported me and maybe may support you too. First was just think about your why and hold on to it. Why nursing? Why did you choose nursing and at this time? So hold on to your why. The reason you chose nursing will guide you through challenging days and keep you anchored in purpose. When things are a bit difficult, when you come and you're not understanding things and it's overwhelming, your why is the anchor. It always be the point of why did I want to come into nursing? And I think that's the main thing. It really anchors you. So you think deeply upon that as well. Secondly, you value your networks. Nursing is relational. Stay connected to the people who shaped your learning. They may become your mentors, your collaborators, and the ones who would, open unexpected doors for you. So it's good to network. It's good to keep those networks and those, with your tutors, with the people that you've met, even with, in your learning experience. Those networks are very valuable, and in the placement areas where you're going. And third, seek mentorship. Be deliberate. Identify people you want to learn from and approach them and with intention. So things like supervision, mentorship become very critical when you start your career journey. But it's something that you can start earlier on. You start to look at people and say, well, I see Mandy, I see other people that I have identified within this field. I want to learn. I want to know how you made it. What are some of your challenges? Here are some of my challenges. I want to share. I want to grow, and mentorship goes a long way in our development. So supervision, mentorship, and coaching are long-term investments in our development, particularly in our career development. And then lastly, we embrace your preceptorship, the period that you have protected when you start your nursing journey. I know within the NHS we have this opportunity to have preceptorship. It is your protected time to learn, ask questions, make mistakes safely, and discover the kind of nurse you want to be. Use it to build, deepen your reflective practice and shape your professional identity. So as you step into the next chapter, remember you're not expected to know everything. You're expected to learn, grow, and show up with curiosity and compassion. Nursing is a journey, and you're in the beginning of something meaningful. I wish you courage, connection, confidence as you begin your practice. Thank you.
Godfrey, thank you so much for that really inspiring presentation. I have to say, I wish that when I qualified many, many years ago, I wish I'd had somebody like you to come and talk to me about, particularly what happens when you qualify, and holding on to that why resonated so much with me. Why did I become a nurse? There are going to be challenges going forward. There are for everyone. It doesn't matter whether at the beginning of your career or getting towards the end of it, there are still going to be challenges. But holding on to why did I come into this in the first place? That was absolutely brilliant. Thank you so much, Godfrey. I really appreciate your time for coming along today and sharing your story. It's been amazing. Thank you. Does anyone have any questions for Godfrey? Godfrey, you said, I have a question if you don't mind me asking, but you said that you went to job fairs and you looked around and you saw that there were all sorts of different opportunities available from the military, and was there something that particularly the NHS? Yes, because I think probably you had spent some time in the NHS anyway. But was there anywhere else that stood out for you that you thought, if I hadn't gone into the NHS, maybe I would have looked at this particular branch, this particular field?
Yeah, like I said, there were charity organizations, and then there was the military. Those are the ones that really stood out for me at the time. It wasn't really about. Among the two, those were the ones that really struck a chord. And I was like, because of the package, it was really enticing. When you go to the military, there's all these payments and that the package that comes along with it is exciting. But then there's a lot of work that comes alongside with it. So I had to make that decision. But also I did mention there was also, there were also opportunities abroad that some of my peers were talking about. Probably you go to America, probably you go to Canada. And I was thinking, no, I know it's exciting. I know it's an adventure. You can actually go, somewhere new and discover. But I've already come somewhere new. I'm already in a field that I feel it's exciting, and it's already the place I want to be. Why do I want to go to somewhere new? But I feel some of it was because of money, but for me it was just because of the passion, and I feel here I will learn and develop more, and develop my career better, especially in the NHS.
Thank you. Thank you. I do have one more question, if I may. You said that when you went onto track, there was so many things that you could look at, and are you going to apply for all of those jobs? Was there anything that you found particularly difficult to navigate with track? And if so, do you have any tips or hints for anybody who might be looking at track now for jobs that might be available to them?
Like I said, thank you for that question, Mandy. Like I said, track is like a minefield, because you go and you explore one area, and then it's almost like it expands other areas. You start to see options and possibilities in different areas. So I was looking, for me, I didn't want something far from where I had trained, because I felt more secure. For other people, it would be different. But for other people, they would want to the adventure of, I want to go to a different place. They are offering something different. And in all the roles, they look the same. It's a band 5 role you're applying for, or whatever role you'll be applying for. But they're all different and unique in their own different ways. Probably it's the way, the culture, probably it's the people, probably it's the location, probably it's the offer. There's something different about different roles that are offered. So for me, it was that. I didn't have the difficulty. It was just the easiness was I saw different options. I could scroll down. It gave me that option. So track gives you options. It's not a limited thing. It provides that options. And those options were really valuable, especially when you want to make a decision and you're thinking seriously about where you want to work. Track was really good for me.
Thank you. Thank you. Are there any other questions for Godfrey just now? That's brilliant. Thank you so much again. Honestly, that was really inspirational, and I'm so pleased that you came today to talk to us. So thank you. And but also keeping to time, which is even more amazing. So if I can bring in Paula now to talk to us about the role of the NMC, that would be fantastic. Thank you, Paula.
Well, can I just start by thanking Godfrey? Thank you. I think that was just brilliant, and I hope as many final year students see that as possible. It's really important to hear your message. First of all, your motivations for coming into the profession, the things that are important to you as a new registrant. Now you hold that dear. I just think there's so much that is so both practical and motivational about what you've said there, and I hope that people see that. It makes me feel very proud to have you as part of our profession as a fellow nurse. So really, really good to hear that. Thank you, Godfrey. So yeah, I've got a few slides. So this presentation was put together by my lovely colleague Wendy Fowler, who unfortunately can't be with us today. And I'm not sure who's driving the slides, whether it's Mandy or Kate. Are you struggling, Mandy? Oh, don't worry.
I think Kate's going to do it because I can't get my screen to share. So
if
Kate would be so kind.
That's all right. There's no worry. So while I'm doing that, I'll just say this. No, I'm not Wendy, but what I am is, my name is Professor Paula Holt, and I'm a senior nursing advisor at the NMC. I say professor for lots of reasons. When I first came into nursing, and I apologise for my age, in 1984, which is like 42 years ago now, I did not think as a student nurse from a council estate in Manchester that one day I would be sat here as a professor with a doctorate and a 42-year career that has been outstanding, mostly in mental health nursing. So, you never know where nursing is going to take you. And that's the first thing to say to everybody on this call that I have found and still find that nursing is a profession that gives you a license to practice in so many different places and have such an exciting career. So I have spent many years working in the NHS. I spent 9 years as an army officer in the armed forces. Godfrey, doing mental health nursing as an army officer. I then went into the criminal justice system and supported both probation, the courts and police, again from a mental health perspective, and then went into higher education and went from teaching all the way through to senior leadership, leaving as a pro-vice chancellor of a university. So when you do start at the beginning of your career, you have no idea where it's going to take you, but how amazing that it can take you to places you never guessed and give you opportunities you never thought you had. I left school without A-levels, so I feel absolutely delighted that I chose a career that's taken me to where I am today. And I don't say that in a look what I've done sense. I say it in a sense of how amazing nursing is for allowing you exposure to all of these different environments. And Godfrey mentioned some of those when he went on track. There are opportunities, and it's not about luck, it's about taking those opportunities when you see them and maximizing them. So are we struggling with slides, or are we okay?
I've got them ready.
Yeah.
I can try and share them, see what happens.
Okay,
let me give it a go.
Okay.
Okay. And then I'm going to try and present in Teams.
If you struggle, let me know and I can try.
I think it's going to do it. It says it's loading the file in PowerPoint, so
Cool.
I'm keeping my fingers crossed.
That's good. So clearly I'm from the Nursing and Midwifery Council, and I joined a few years ago when I actually left my university role, and I worked part-time at the NMC. It was part of my trying to wind down towards retirement type job. However, it has been a very impactful job at the NMC, and my current work is on the revision and update of our code, which is something that is critical to how we all practice. Brilliant. Thank you so much. Really happy to see that. So if we go through the first slide, obviously we've got Wendy introducing herself, who sadly can't be here. And if we go on to the third slide. Oh, are we struggling?
Have you got them? Because it was still
Right,
loading and then they came up and then they went away again.
Let me see if I can. Let me see if I can. Just going to share. See what I've got. Oh, is that you sharing? Oh,
I've got them.
I've
got them, Paula.
Oh,
okay.
That's amazing.
Thank you. It's Debbie.
So,
thank you.
So because we're tight on time, we're going to talk about a few things and not talk about other things. So we are going to talk about the role of the NMC and registering with the NMC, because I think for those of you watching who are yet to register, it's important to know what that process is and what your role is within that process. We're going to look at the scope of practice for nursing associates as well as for registered nurses. Now, Wendy's put that in because she gets lots of questions about the difference between those two roles, and in particular the implications for a registered nurse of working with a nursing associate. So I can see why she's put those in. We'll have a pause, and we have got some slides in here on the code and revalidation, but I'm more than happy that if people who are watching this want to see this set of slides, that they can access them, and I'm sure we can find some way of doing that. So we've got lots and lots of slides that talk about our review of the code and revalidation. I'll mention it right at the end, but I don't want to go into detail about that, because at this point in time your prime concern is getting towards the end of your programme, registering and getting your first role. So that's what the focus will be. So if we go on to the next slide. For those of you that don't know, and you all should know, the Nursing and Midwifery Council are your regulator. We regulate nursing, midwifery and nursing associate professionals. We don't regulate where you work, we regulate you as professionals, and that's our job. We also have a support and influence role as well, because we are networked into everything and everybody, including our wonderful NHSE colleagues who are on the call today. So we're in the system and try and support and influence as much as we can, but our core role is to regulate, and that is to make sure that we not only support our professions, but that we are here to be able to protect the public. So we do lots of other things, but protecting the public is why we are here. So we'll go on to the next slide and you'll see some of the things that we do as the NMC. So you will know, those of you that are at university at the moment on a programme, that the Nursing and Midwifery Council set the standards that your programme has been designed to meet. We don't make your curriculum up, we don't put your curriculum together. What you do as universities, all your universities do, is they pull together a curriculum that meets our standards, and the NMC have to approve that programme and say, yes, this programme at your university meets our standards, and at the end we will have a registered nurse, nursing associate or midwife that meets our standards and will be suitable to go on our register, with a couple of caveats in there which we'll cover in a moment. So that's our role. The reason it's important to say that is because curricula across the United Kingdom are very, very different. What is required for a student nurse to learn in inner London might be completely different to the expectations of learning in the Highlands and Islands of Scotland, for example. So our curricula have to not only meet the standards, but really meet the requirements of the regions and the areas where programmes are being delivered. And programmes do come in all shapes and sizes. Some have practice learning that is in different parts of the curriculum. So we have one university, for example, that has no practice placements in year one at all, but they do have them sort of loaded more towards the end of the programme. So your curricula, that is your university's responsibility, but we set the standards that will really structure what your curriculum will look like. The important bit here for you, at the end of your programme, you will come onto the register. So one thing I want to say right here and now is that when you get your PIN, it is not something that is easily going to be taken away from you. One of the things that makes me really weep is when I hear students in practice hearing words, oh, you'll lose your PIN for that, and these sorts of negative comments. What we at the NMC really want to do is support good practice. A teeny weeny minority of nurses and midwives and nursing associates end up being referred for fitness to practice. The vast majority of our profession practice in a really good way that promotes and supports our patients and each other, and is really commendable in terms of meeting the expectations of the code. So once you're on the register, hopefully you will stay there, like me, for a very, very long time. And that's what we want. We want to keep you in the profession. You know, listening to Godfrey talking, crikey, who would not want to keep Godfrey on the register for the entirety of his career? So at the NMC, it's in our interest to do that and to make sure that we do support and maintain you on the register. We promote lifelong learning. We do have post-registration courses that we approve in community specialist practice and specialist community public health nursing, like health visiting and school nursing and occupational health. But your CPD that you will have once you are registered is not always something that will be approved by the NMC. But as we'll see with revalidation, CPD is really important. To maintain you on the register, you will have to revalidate every 3 years. Everyone on the register has to do that. I'm about to do it again in September. I've done it lots of times, and I'll be going through that again in terms of revalidation. But that makes sure that every 3 years, we are mindful that we've done enough continued professional development, we are fresh, we are up to date, and we're contemporary. And we owe that to our patients, and we owe that to the people that we work with. So if we go on to the next slide. So I apologise for the busyness of this slide, but this has been put here by Wendy, and I know why she's done it. It's so that you can look at it in your own time and understand the initial registration process with the NMC. Now, this slide is here for 2 reasons. One, it's to guide you, but 2, it's to stop you phoning your university every 10 minutes saying, why haven't I got my PIN yet? Why haven't I got my PIN yet? If you know what the process is and what some of the hurdles are or difficulties are, then hopefully you will get your PIN as soon as possible. This process is really quick. So when we get phone calls saying, oh, I can't believe it, my university uploaded my stuff 3 months ago and I haven't got my PIN yet, we've often got in touch with the university and they haven't quite finished uploading yet because they were waiting for this, that and the other so they can everything as a bulk upload. So what happens is your university will upload onto our portal at the NMC that you have completed your programme. And that will include all of your personal information and details about your education and training that will tell us that you have met our requirements to be a registered nurse, midwife or nursing associate. But please ensure that your university has the right information. We often have email addresses that are redundant, because when you started at the university, you might have given your university a particular email address and that may have changed. We don't always keep the same one. So do make sure that your email address is up to date and that all your personal details are up to date in terms of your university. So that's number one. Check that, so that when the NMC get back to you, they get back to the right person. The second thing is that sometimes the emails can end up in your junk folder, which is terrible when it's come from the NMC, but apparently it can happen. So do check your junk folder as well. So once we've received all your information, a file will automatically be created for you, and an email will automatically fire off to you asking you to register. And it will be sent to that email that the university have supplied. So do make sure it's the correct one. You'll get that email, and that's going to prompt you to create an NMC account. So complete the application form, pay the registration fee. Sorry about that. And that's due to go up, but sadly, it's one of those things we all have to do as registrants. And then once you do that, that's it. The university will get another message, which I'll talk about in a moment. So we'd expect you to do that response and register with us within 6 months of completing your programme. If you've not registered within 6 months of completing your programme, when you do register, we might ask for more information. So it's helpful to do it in the first 6 months because it's incredibly straightforward. What we also ask of from the university, once you have got your online account, is the university has to confirm that you're of health and character that meets the requirements. Ignore the word good health, because people like me are not necessarily in good health, but we're perfectly functional, thank you very much. So it's about having the right level of health to be able to do your job and your character. So hopefully your university will send that health and character tick in the box to say, yep, your health is okay, your character is okay. So the only time that would be questioned is if you've had something come up on your DBS that the university has to disclose that's not been dealt with. But in my experience, that is dealt with well before you get to this registration period. Once we've received everything and your registration fee, we can then assess the application. It usually takes about 24 hours before that application is reviewed, and that's it, your PIN is sent to you. So it can be very, very quick. And in fact, I guess because a lot are uploaded in September, that often will have a backlog of a couple of days, but it's not weeks. So if there is an upload, if you are waiting, it shouldn't be very long. So I'll let you read that in your own time when you get a copy of these slides, which you can ask for a copy of, so that you can go through that in slower time. But if we go on to the next slide. This is just one that Wendy's put together, and I think this is really important because I know that we have many nursing associates in England. Obviously, we don't have them in the other nations because we do have registered nurses that come from the other nations, but we don't have nursing associates because they're only at the moment educated in England. But as you can see, there are different platforms. You've got the 7 platforms that are in the nursing standards, and you've got 6 platforms in the nursing associate standards. And you can see there is a slight difference between those. There's a much bigger emphasis for a registered nurse in terms of coordinating care and delegating, and that real focus on leading and managing. So Godfrey will be able to, I hope, nod and agree that as soon as you become a registered nurse, you are a leader, and it is a leadership role. I think many people think when they go in, you're going to be sort of I don't know, you're going to be in you are in a preceptorship, you'll be learning, but you are still in a leadership role. And within quite a short period of time, your registration should have prepared you to be able to work alongside and delegate to nursing associates, to work with students, and to work with healthcare support workers. So, that is why that leading and managing is so much more in the future nurse standards. So that shows you the difference between the two, and there is. However, as we see on the next slide, both the registered nurse and the nursing associate are accountable as far as the code is concerned. So, you know, nursing associate is accountable for their own practice and has their own PIN. So if we go to the next slide, you should be able to see that. So those professions, the three professions, nursing, midwifery and nursing associates, they have different knowledge and skill sets, and they're set out in very different standards of proficiency. You as a nurse, midwife or nursing associate should know what your proficiencies are. Please don't, when you've finished your programme, think that that's the last time you ever have to look at your proficiencies, because you will have covered all of your proficiencies in your education over the 3 years. But to be frank, you'll have covered some more than others. So I would expect within a mental health nursing curricula, for example, where you're doing a registered nurse with the practice applied to mental health, you may have spent an awful lot of time on the Annex A proficiencies so that you've developed really good communication and interpersonal skills. You've learned about motivational interviewing and lots of other things. You may not have had as much focus on some of the Annex B proficiencies. You will have seen them and experienced them and have awareness of them, but you may not feel proficient in them. So there's always work to do to make sure that we enhance our proficiencies. For me, being a registered nurse and getting that PIN through, it's really like having your driving license. You really start to learn as soon as you step foot into the door of your new role as a registered nurse. And one of the things that I guess sometimes is a challenge to us at the NMC, why can't that newly registered nurse work really well in the forensic psychiatric area? Why can't a newly qualified nurse know what they're doing when they're working in A&E as their first role? Well, the bottom line is this is your driving license, and you have got a good proficiency in everything you need to be a registered nurse. You are not deficient because you don't know how to work in every single area of adult mental health, children's or learning disability nursing. What you are is proficient as a registered nurse that is open and ready to learn about applying what you've learned to this new area of practice. And that is what preceptorship is for. Something that Godfrey said that's really important is when you do go into your first role, you identify somebody who is going to be a good support and mentor for you. You work out what it is that you need to learn, because there'll be some things that you're really good at and you can just fly with. There'll be other things that you really need to focus on. You know, because you're abiding by the code, that you will never step outside of doing anything that you are comfortable doing. If something is not within your capability or your knowledge or experience, you have a duty to say, no, I can't do that. I don't know how to do that. I need to be taught. And that is not a failing. That is you asking for extra education, training, support to be able to do your job well. So we do have to very much in the code look at the limits of our competence, the limits of our proficiency, and make sure we work within that. And then you've got the rest of your career to develop those proficiencies, to develop that competence, to become that experienced registered nurse in whatever field you are and whatever area you're working in. But don't feel under pressure when you step into your first job that you have to know everything on day one. That ain't going to happen. I recall very much walking into my first role in an acute medical ward, and I think within the first week told myself, Paula, you need to know more about every single blood result that's coming in. You need to understand how to read an ECG. You need to know what to do in this and this scenario. And I knew myself then, working with somebody who could mentor me, what it was I needed to learn to be the best I could be as a registered nurse in this new environment I was working in. So, you know, Godfrey hit the nail on the head. Make sure you've got somebody really good that can take you through your preceptorship, that can mentor you and support you to be, you know, the person that is confident in this environment. And that is going to take a little bit of time. It's not going to be overnight. And never feel pressurized and never feel that you're being criticized if you don't know everything on day 1, 2 or 3. It's not going to happen. So if we go on to the next slide, I think it's just she was just reinforcing this about working within one's competence, but I think we've sort of said enough on that subject. So if we go on to the next slide, Mandy, you have a question, please feel free.
It's just to say that we're a bit short on time, Paula. As it's brilliant, don't get me wrong, it's absolutely fascinating listening to you.
But so this can be the last slide and then we go on to a Q&A, if that's okay. So the very last slide is just looking at, for people to look at their revalidation requirements. The only message I want to give here is that your revalidation starts on day one when you get your PIN. Start collecting evidence straight away. Don't leave it till the last minute, so that you end up 3 years later scurrying around trying to find evidence of feedback. And when you've done continuing professional development, start doing that on day one. If we go on to the next slide, which I think just says, let's stop now. Yeah, so that's just a newsletters one. So the next one is the last bit. And then we've got, after this, if people want them, lots of slides about our review of the code and revalidation.
Thank you, Paula. Honestly, that was again, I wish I'd had somebody talk me through that when I first qualified as well, because I think that would have been so helpful. It was really clear and you know, set out exactly what's going to happen. I'm getting a poor internet signal, so I might have to turn my camera off in a minute or two, but I just wanted to really say, Paula, thank you. Are there any questions for Paula at this point? If anybody does think of anything, oh, we have got one, Linda.
Good afternoon, and thank you, Paula. I'm here, but I think maybe I shouldn't be, because I have got my PIN already. But my question is, it's taken me like 4 months now, just trying to get a job, you know. So my question is, how long does it take? I mean, if I don't get a job for a long period of time, which I'm hoping not, does that affect my PIN or revalidation?
So it's a bit echoey. So as you can see,
Do you just want to go back to mute?
Oh, okay.
Sorry about that, Linda. It's really difficult when somebody talks, it just echoes back when we've got more than one on. So please don't worry. So the number of hours that you need for your revalidation is over a 3-year period. So if it does take some time to get into work, you should still have plenty of time. And I know you're doing this already, but please be as wide in what you will accept in terms of your first role, because getting the experience is really important. I'm talking to many people about to register at the moment that are looking at working in social care, for example, and working in areas outside the NHS. And you know, you can have wonderful, valuable experience with some fantastic people to mentor you. So it won't affect you, as long as hopefully within the 3 years you'll be able to meet those hours for revalidation, and you should easily be able to do that.
Okay, thank you very much. Yeah.
Thank you. Are there any other questions for Paula, or shall we move on to hear what Kate has to say, which I think is going to be really helpful as well? Okay, thank you very much, Paula. That was brilliant. Kate, if I can come to you next, thank you.
Thank you very much. And I'm just going to share the slides. My colleague Davinia and I have been promoting the Future Ready webinar series, which this webinar will be hosted on the Multi-Professional Learner Toolkit app. So we're going to talk to you a little bit about that, and also how we can help you with your interviews. And so I'm going to signpost you to some of the Future Ready videos around interviews. And as Paula said, you know, there's a lot of help out there, there's a lot of opportunities, and the Future Ready series has got a lot of external to the NHS webinars that will really hopefully help you see those possibilities, as Godfrey spoke about. So I do feel like we're tying this all up really well for everyone. So the Multi-Professional Learner Toolkit app, if you haven't already downloaded it, is available on these QR codes. It's been in the East of England now for over 2 years, and we have unlimited licenses right through for the next 3 years. So, you know, real opportunity for us to strengthen all the support that's needed for all of our learners in region. And it's a collaborative piece where both our students and our student council have really ensured that it is designed by students for students. and that our universities and practice partners in the East of England, as well as colleagues in NHSE, have all got access to keep this live and making sure that it's relevant for all of you to get the most out of. And we realise that, you know, those that are graduating this year will need additional support to make sure that they've got that edge when they're going for jobs. So we hope we've been able to do that with the app and the resources there. But there's also things around academic concerns, financial concerns, feeling overwhelmed and stressed, or just some of those key pieces of research that have been undertaken in region that that meant we wanted to signpost you to all the resources that are available rather than you having to go and find them. So it is a one-stop resource. You can download it. This is a great promotional video if you want to watch it from one of our regional university students. Actually, we're just saying how great it is, and certainly when I go out and about and promote the app and get people to download it, there's always people in the room going, you've got to get this. So it's one of those things that we're at 58% of our regional students have got it in the East of England, and we are about to go national, and other regions are also going to have this app for all the students. So hopefully by the end of this year, every student will have access to the Multi-Professional Learning Toolkit app. It's there to support learners with great tiles on it, and it's really easy access. There are alerts, but they shouldn't cause you too many concerns. It just means perhaps once a week you can just go and have a look at some of those things that have come up. And while it's called alerts, it's same as other apps and prompts that you might get, just things that might be of interest to you. But all your placements are in the placement tile. All your university information is in the university tiles. If you want to raise a concern, your health and well-being, and career preparation, which is what we're talking today. So students do love the app. We know that from the feedback that we got from the evaluations that we've done, and also because we can monitor a lot of the infographics and make sure that we've got data that says that students are accessing it, which is fantastic, and we know that we're getting that response. There's 24/7 support there as well. There's ways of being able to get that career preparation or that health and wellbeing support with some real insights, and lots of things that you can do on there. So hopefully you'll download it and have a look. But Future Ready, I just wanted to chat to you about the Future Ready. So we've put in many ways 3 kind of headings under Future Ready. One is a 6-week bite-sized webinars to help improve your employability skills. So if you want to go and see the one on interviewing for success or writing CVs and applications, and you know what happens after you qualify, we're very fortunate that the NMC and colleagues on the call have been able to pull all that together into specific webinars of a series that will hopefully help you explore job opportunities, as Godfrey said, and where to go looking. On the career preparation tile as well, we have a Padlet document where we are constantly putting links to jobs that are coming up in region, so that there's a one-stop resource for jobs as well. And then there's our Student Hub, which was a national initiative, which has got some amazing resources and films and videos on there as well to support you. So lots of activities from the Royal College of Nursing, and there's our transition to employment vacancy platform. Preceptorship, for those of you looking to work in the NHS and are moving into preceptorship, there's lots of information about preceptorship. And so I guess I'm here to promote that. And from Davinia and my perspective, we will be coming out to support the Student First Destination Survey, and Debbie and Mandy on the call as well. So we'd like to know where students in their 3rd year are actually looking to be employed, and we will be offering short taster sessions like one on interview preparation, which is available also on the app. So you know, if you're thinking about preparing for an interview or applying for a job, or if you're writing your CV, we can also come out, hopefully be able to see you actually in university or placement to promote those. And on that note, I'm going to stop because we've got 3 minutes to go. But thank you very much for hearing about the app, and please download it. I know Debbie's kindly put the entire series for Future Ready into the chat, but we've got sessions from the prison service, there's things from Indeed, so you can promote how to use Indeed to look for jobs. We've got things from the National Institute of Research, also the NHS graduate offer, because there's a graduate program, and then we've got profession specific ones like today on mental health nursing, but we've also had those for other professions as well. So please do tell your colleagues. Thank you.
Thank you, Kate. I was so engrossed in listening to you, I forgot to take myself off mute, but that was really good. So I think we are coming to the end of the webinar. Are there any questions for any of our speakers that you've thought of while people have been talking? No? Okay. Oh, Debbie, you have one.
Yeah, it wasn't a question. It was just to point out, Linda I can see is gone, but to Juliet and Hugo, on the Healthcare Learner Toolkit app, there is a letter from our regional chief nurse, Louise Ashley. So if you haven't downloaded the app, do download it, because the letter is there, and the letter does offer one-to-one support with us as the senior clinical leadership team. So if you are looking for help, go to the app. The letter is there, there's the clear email address, and we are, as a team, are very willing to meet and offer one-to-one support in order to guide you through the current challenges that you may be experiencing in securing posts. Thank you.
Thank you, Debbie. I think that was really helpful. So that was great. And I think as we're coming to the end of our time, I just want to say a really heartfelt thank you to Godfrey and to Muriel, who was sitting there as well, but to Godfrey for his inspirational talk, and to Paula, because I think you have really explained things so clearly about how it all works and what to expect in the next few months as you complete your programs. So thank you very much. And to Kate as well, because I know we didn't leave you very much time to go through a lot of information in a very short space of time. So I appreciate how quickly you went through all of that. And I know that we didn't quite get as far as the interview preparation, but I do believe that information is on the app. So it's there for when you download it. So Godfrey, you have a question. Would you like to come in?
Sorry. Yeah, so actually, Muriel just wanted to say something.
Yeah, I just wanted to say thank you. As myself, a final year student, I'm meant to graduate in this summer. I just wanted to say thank you. It was very insightful. And I do also have an upcoming interview in a couple of weeks. So I think I'll definitely need the resources. So just thank you.
Thank you.
That's
everyone.
great. Thank you, Muriel, for that lovely feedback. That was so nice to hear. Thank you. So again, thank you to everybody. We're just over time, so I appreciate everybody's time today. And if there's any further help you need, just please do get in touch. All of the contact details are on the app, and so will the recording of this webinar be, and the slides, everything will be there for you to be able to access. So thank you very much, everyone. Goodbye.